Hello and welcome back to the Caregiver's Haven, your go-to resource for reliable health information. We're here to guide you through the often daunting world of health concerns, helping you navigate the facts, debunk the myths, and understand your way to better health. If you're new here, consider joining our community by subscribing for regular updates. Today we're tackling a health issue that many encounter but few fully understand: urinary tract infections, or UTIs. So let's dive into this common but often misunderstood health issue: urinary tract infections, or UTIs. First, let's understand our urinary system. This essential system in our body comprises four main components. The kidneys, two bean-shaped organs, filter waste from our blood to produce urine. From the kidneys, this urine travels down two tubes known as ureters into the bladder, a hollow muscular organ that stores urine until it's ready to be expelled. Finally, the urine exits the body through a tube called the urethra. Now, imagine a scenario where bacteria find their way into this system. They can climb up the urethra, multiply, and cause an infection. This is what we call a urinary tract infection, or UTI for short. These infections can occur in any part of the urinary system, but are most often found in the lower tract, which includes the bladder and the urethra. A UTI can occur in any of these parts, often involving the lower urinary tract, which includes the bladder and the urethra. UTIs can be sneaky as they don't always cause symptoms, but when they strike, they can present a range of discomforts that often prompt us to seek medical attention. You might feel a persistent urge to urinate, only to release a few drops. Then there's the burning sensation during urination, which can be quite uncomfortable. The urine itself might appear cloudy or have a strong, unpleasant smell. Some people may even experience lower abdominal pain or, in severe cases, see blood in their urine. Now, these symptoms can vary depending on which part of your urinary tract is affected. If the infection is in the bladder, you might experience pelvic pressure, lower abdomen discomfort, or frequent painful urination. A kidney infection, on the other hand, might trigger upper back and side pain, high fever, shaking and chills, nausea, and vomiting. Remember, early detection is key, and knowing these symptoms can help you identify a UTI before it becomes more serious. The symptoms can vary depending on which part of the urinary tract is affected. Several factors increase UTI risks, like female anatomy, sexual activity, certain types of birth control, and menopause. The shorter urethra in females makes it easier for bacteria to reach the bladder. Sexual activity can introduce bacteria into the urinary tract, while certain types of birth control, such as diaphragms or spermicidal agents, can also increase the risk. After menopause, a decrease in circulating estrogen can make the urinary tract more vulnerable to infection. But don't worry, there are ways to lower your risk. Drinking plenty of water helps dilute your urine and ensures that you'll urinate more frequently, flushing bacteria out of your urinary tract. Wiping from front to back after urinating and after a bowel movement helps prevent bacteria in the anal region from spreading to the urethra. Urinating after sex can help flush bacteria away from your urinary tract, preventing infection. And avoiding potentially irritating feminine products like douches and powders can keep your urethra free from irritants that might make it more susceptible to infection. When it comes to treatment, UTIs are commonly tackled with antibiotics. The type and duration of antibiotics may vary based on the infection and your overall health condition. For simple infections, you might need to take antibiotics for 1 to 3 days. However, a more complicated infection might require a longer course of treatment. For severe UTIs, IV antibiotics in a hospital may be necessary. While antibiotics are the primary treatment, you can ease discomfort by drinking water, avoiding bladder irritants, and using a heating pad. Home remedies such as these can play a crucial role in managing UTIs. Besides, lifestyle changes like maintaining good hygiene and staying well hydrated can significantly help in preventing UTIs. Recent medical research has also highlighted the effectiveness of cranberry products in preventing UTIs. Whether it's cranberry juice or supplements, incorporating them into your diet can potentially reduce the risk of UTIs, especially in women with recurrent cases. But remember, these remedies and lifestyle changes should complement, not replace, prescribed medical treatments. It's important to consult your healthcare provider if you suspect a UTI. Remember, early detection and treatment of UTIs can prevent complications. Stay informed and consult your healthcare provider if you suspect a UTI. In the world of health, knowledge is power. If you found this video helpful, give it a thumbs up. It helps us reach more people who may find this information valuable. Don't forget, sharing is caring, so feel free to share this video with your friends and family. Everyone should have access to this important information about UTIs. We're also very interested in what you think. If you have any questions or if there are other topics you'd like us to cover in future videos, please drop a comment below. Your input helps us create content that meets your needs and interests. We know that health topics can sometimes be overwhelming, but remember, you are not alone. We're here to provide you with accurate, easy-to-understand information. Thank you for being a part of our community, and thank you for watching.